There's a lot has been said about this healthcare tax law, and I've heard a lot from small business owners. I've heard from seniors. I've heard from medical device manufacturers. I've heard from orthodontists. I've heard from rural and community healthcare systems and hospitals. All of them look at this as a burden. I heard from a chairman of the board of a hospital in Wythe County who said Obamacare is going to put rural community hospitals out of business. I've heard from seniors, I've heard from doctors that doctors, you may have health insurance, but you're not going to have access to doctors who are not going to want to take Medicare patients. For small businesses, this is the #1 impediment to hiring more people on. If anybody has a business anywhere near 50 employees, they don't want to go over 50 employees. And some that are slightly over 50, they're talking about making some of their employees part-time, which is tough for those employees that'll have to find another job to make ends meet. And those who have large numbers of employees, for example, I heard from a woman in Virginia Beach who said her husband, she gets insurance through her husband's company that's got 300 employees, and they're looking to pay the fine or pay the tax rather than provide health insurance, and that's very disquieting for folks. So this is one of there's so many reasons that this ought to be repealed and replaced, and that's a big difference with my opponent who has said that Obamacare would be great for Democrats and it's a great achievement. I want to be the deciding vote to repeal it and then replace it. And replace it with what? #1, health savings accounts. Health savings accounts are more affordable, more personal, and they're portable. You can take them from job to job. And it's the approach we need to take so that people don't have to worry about, gosh, if I switch jobs, I won't be covered for a malady or a malady that someone in my family may have. And I'm not just saying this for everyone else. Our family's using health savings accounts. And unlike folks in Washington to tell all of us what to do, I think Washington ought to live under the laws they impose on everyone else. And so I think health savings accounts are the way to go for more affordable, portable, and accessible health insurance. The other thing for small businesses, this is a really important reform, and that is to allow small businesses to band together across state lines and thereby have a bigger risk pool and avail themselves of more competition, more choice, and more affordable health insurance. And finally, I think the states ought to be given greater flexibility to manage the Medicaid program. The states are laboratories of innovation, and they'll come up with better and more efficient ways of providing medical services. The one aspect that I do think ought to stay with the healthcare tax law could be reinstituted, and that is allowing children to stay on their parents' policies until age 26. The job market is terrible these days for young people, and it's better that they be covered by some insurance rather than none of all. But the main reform, the main principles that need to be driving healthcare reform should be patients and doctors making healthcare decisions, not bureaucrats in Washington.